Hello, everybody, and welcome to Irish Hypnotherapy Conference 2025. And today we are talking to Giancarlo Russo, all the way from Italy. How are you,
Buonasera.
Giancarlo?
Ciao, buonasera dall'Italia. Good evening from Italy, John. How are you?
I am very well. You threw me with the Italian there for a minute. I was like, oh, what?
Oh, thank you so much.
Um, so looking forward to seeing you in Dublin. So looking forward to see you.
So do I.
It's going to be an amazing event. And I'm just, so many people would like to know who Giancarlo is. So who are you and how did you get into hypnotherapy?
First of all, I'm very happy and very honored to be part of the Hypnosis Conference in Dublin 2025. And so I'm going to introduce a little and speak a little about myself. Giancarlo is a physiotherapist from Italy. I'm specialized in neuropediatrician rehabilitation and functional neurology rehabilitation, as well as since 1986, I'm in the hypnosis field. I started by incident to practice some hypnosis, and then this passion became part of my daily work, of my daily routine. I start by incident because I met a stage hypnotist, but then I start studying very seriously hypnosis. I've been to the US studying, I've been to the UK studying, also in Italy I've been studying, and I'm very deep into the clinical aspect of hypnosis. I mainly work on stroke patients with hypnosis. I mainly work in chronic pain with hypnosis, and I'm one of the few physiotherapists to have a publication on PubMed about hypnosis in pregnancy. Because before the pandemic, me and the gynecologist, we open a consultory in the hospital to help pregnant women to deliver. And we call it hypnosis. That it means hypnosis plus gynecology.
Right.
And we develop the clinical aspect. Then, in the same time, we open a little studio inside there for the chronic patients, for chronic pain patients and oncological pain patients. So to help them with hypnosis. Unfortunately, pandemic was terrible in my country, so we had to stop this big activity. But it was very great to have all the application of hypnosis in the real clinical field with the real patients, because in the hospital you see real patients,
Yeah, of
real
course.
patients that they came for free. In our country, still for free, the hospital. So you can imagine our studio was full of people, our clinic full of people asking for help because they're looking for hypnosis, at least in my country, when medication fail, where they cannot take any more the medication, or maybe when they have some collateral effect or side effect with medication, they come up to you and say, oh, Giancarlo, can you help me with hypnosis with this pain? Because I took this, didn't work. I took this other, didn't work. I did rehabilitation, didn't work. Can you hypnotize me? So we had a very good casuistic, and we have a
And
high number
yeah,
of
and I
patients.
was going to ask, what were the statistics on that? What were the results on those studies?
I would say I disagree when people make this big division between high, medium, and low hypnotizable people. I would say that everybody had some result. Of
Yeah.
course, some people have bigger results, some other people had lower results, but it doesn't have nothing to do with high, medium, or low hypnotizability. It has a lot to do about what people need in that moment. Some people came to see us like the last solution. So, of course, also if they were, as let's say, low hypnotizable, in that moment, we were the only hope for them. So they
Yes.
activate their brain so to have results. So we can help them better. It's not a matter of hypnotizability. It's not a matter of hypnotizability. It's a matter of how many resources they have to invest in the process, right?
Yeah. Yeah.
Yeah. So
But
when you have no other chances, you give 100% of yourself in that process,
but
right?
were you able to publish results that showed that hypnosis was effective in that context?
No, we cannot. We
Okay.
cannot. Right? Because of course we cannot find an indicator to say, okay, we start from this point, we arrive to this point, but a personal sensation. When you talk about pain, the only things you can do is the VAS, is the
Yes.
visual analogic scale about the faces, or you ask the patients from 1 to 10 how much is your pain in this moment. But you cannot make science with this
No,
kind
of
of
course.
assessment because it's very personal. So you
Yeah.
cannot say it was hypnosis to improve the pain, because maybe after the patients went to his training, went to his physiotherapy. So how can you say this?
So
Or
are you
at least
saying that Are you saying the pain went down, but you can't isolate the cause of it?
Yeah. Yeah. To be honest, yes. Because in our hospital, when patients came with pain, they are under medication or under rehabilitation, under physiotherapy, or also under hypnosis. So you have the combination of so many
Of
factors.
so many factors. But
Yeah. And you
the
cannot
pain does.
say he improved for my hypnosis or improved for the medication.
Right.
The only
Okay.
things they want to see is the patient improve. And
Improve. But
you
the
know better
patients
than
did
him, you
improve.
know very well, chronic pain is not acute pain. It's a completely different activation in the brain areas. It's completely different. It's a
Okay.
lifestyle problem, more or less.
So which one is hypnosis more effective for then?
I would say it depends. It depends because I see different patients with acute pain. When you have to do with chronic pain, you can have different way of working. You can work on a structure or you can work on the emotional side of pain. You know, when you work about the structure, you just have to imagine the part became frozen and frozen. When you work on the emotional pain, you can work on the actual pain, maybe memories of the pain they experienced before, or maybe the evolution in their mind of how the pain will be in the future. So you have three different ways to access the pain.
Mm-hmm.
I would say it works very good in both cases, both acute and chronic pain. Now we are doing a very good research that maybe we're going to publish on vaginism. So
Okay.
on pelvic floor pain and penetration pain for women, that the so-called vaginism.
Okay.
And
And
we've
is it
seen,
again that done on those same parts of physical and emotional?
yeah,
Yeah.
yeah.
Okay.
Sometimes
Okay.
it's, yeah, definitely.
Okay. Cool. So you're going to be talking on. Do you want to tell us about what your talk is on in Dublin?
I will come to Dublin to give a lecture and to talk about non-verbal hypnosis. Then there is a special way for the hypnosis induction where no words are used, but you will use the fourth channel of the non-verbal communication. I'm talking about the sounds that you can do with your mouth, the distance between you and the person, the way you move your arms, and the way you touch the person. All these four channels can help the person, the patient, or the client to step into the hypnotic state. Oh, yes, I'm maybe one of the last to still use the word hypnotic state and not
Right.
process or different. I call it state. I'm from the old Knox school and we used to call it state. Also, if somebody will disagree, I said, okay, no problem. I call it state. So I will give a lecture as well as a demo, as I
Okay.
like to do, on how these tools can be very effective to help the person to access to that particular way of functioning of their brain that we call hypnosis. Maybe somebody else in other culture has a different name to call it. Somebody call it meditation, somebody else call it mindfulness, somebody else call the way they want. But of course, we can help the person with this way because all of what I will talk about, it will be about the relation between the mother and the baby from 0 to 12 months, where the baby cannot speak because, of course, he doesn't have the words and he doesn't understand the words they're talking to him, but he understands the gaze of the mother, he understands the contact, the warmth of the body, the sound of the mother's voice. And so they have this very strong way of communication that also a very famous psycho from the UK was called John Bowlby, built his theory and called the attachment theory,
Mm-hmm.
right? From where you will build your personality when you grow up. And this will be the main topic of my lecture in Ireland this year. And I'm very happy that I can share this information with the people that will come because it can really enhance your induction to a very high level. You
Now,
can choose to use only not verbal induction, or you can mix verbal and not verbal to reinforce the induction. And you will see it will be very interesting to do this experiment and to share this info.
you also work with children a lot, don't you? I mean,
I work with
pediatrics.
children, so I should have for sure a way to communicate with the children.
Yes.
Because you know the children are used to the mother contact. The moment you have to manipulate or to do rehabilitation to them, you establish an hand contact with them. They can accept or they can refuse this contact. And the only way they have to express with you they're refusing, they will cry, right?
Yes.
So you know in real time if what you do they like or they dislike, right? So you know how to approach which part of the body you have to approach, which way, which which amount of force you have to use in approaching. And the same thing will be with adults.
So
No
that's what I
difference
was
with
going to
adults,
say. So
because
you're
we do
taking that.
hypnosis to access a low part of the brain. We're not in the cortex. We are really down in the subcortex, and the baby, it's all subcortical. It's everything subcortical because it doesn't have the maturation of the prefrontal cortex, right? And
Yeah.
hypnosis works at that level, right?
So you're taking what you've learned in the pediatric level and applying it to an adult then, is that right?
Exactly that.
Oh, wow.
Exactly
Okay.
that.
I'm
We
looking
have
forward.
a baby inside. And I'm not talking about the Eric Berne transactional analysis, right?
Yeah,
But
yeah,
we have the inner child.
yeah.
And it's that part of the brain, the subcortical, that it's related to our flight or flight reaction and the freezing reaction. That's the subcortical. This is where we want to go in the limbic system. We
Yes,
want to activate amygdala. We want to be there with hypnosis. I
yes.
don't care so much about the prefrontal cortex. That's why I barely use verbal hypnosis.
Okay.
Because, yeah, you can deactivate the prefrontal cortex talking and relaxing, or you can deactivate the activity in the prefrontal cortex exciting the amygdala. This is what happened in the fight or flight reaction.
Yes.
Amygdala spreads so much that it starts the secretion of those neuromodulators to reduce the activity in prefrontal cortex, right? So I
Yeah,
use the
absolutely.
opposite way. It's the old way. If you study the theory of the emotion of Cannon Beard, he speaks about all the new way. So I don't want to go in the prefrontal cortex, like take a deep breathing, close your eyes, and blah, blah, blah. I just excite the amygdala. So
But
to
that's where
help
we
the
all want to
prefrontal
be.
cortex to reduce its activity.
Yeah. Yeah. Or when you're working with any kind of trauma of any kind, it's the
Of
amygdala you want
course.
to be in. Absolutely.
Exactly that. Exactly
Exactly
that.
where we need to be. I'm
Yeah.
going to really look forward to this conversation. This is going to be a really interesting. And you're going to demo it as well.
Of course. That's the best part, to give demo.
Excellent.
Yeah,
Right.
I like to give the demo because you know what's very important, John, that people understand that you can use not verbal in Italy as well as in Ireland, as well as in Argentina or Japan, because we work at the subcortical level all the same. It's not a matter of the language. It's not a
Yes.
matter of understanding what I'm talking about. It's a matter to decodify my contact on your body, my gaze, how I move my lips. You know, you have that colony of neurons that is called mirror neurons,
Mm-hmm.
and they are activated as soon as you establish a contact, eye contact with me. And I know how to use those mirror neurons, right? So to help you to go into that state or to leave all the unnecessary tension that you have in that moment.
I really am looking forward to this because demonstrations are a big part of what we do in Dublin. I always
Oh,
love to
yeah.
see them. It's the
Looking
way I
forward
learn.
to.
So you can count me in on that one.
Oh, yeah. It will be great. I was looking
Um,
forward.
so it's body language, signs of hypnosis, reading emotions, and deep induction procedures.
Yeah.
That's going to be that's really something to look forward to. It's
And
different. It's very different from what you would normally see.
yes,
Um,
it's very different of what you normally see in hypnosis. And don't want to say what is better or what is worse. It's only different. And they
correct.
can combine very good together. This is what it doesn't
Yeah.
go against the other. But
No,
when
no,
they're together, they work perfectly.
and this is the advantage of conferences and conventions is that you get to take what you want from various presentations and apply
Exactly.
what you want.
Exactly that.
But if you're working with children, for instance, this would obviously be hugely invaluable because it builds trust and rapport at that obvious stage.
Totally
But
agree.
yeah,
Totally agree.
well,
Yeah.
okay. I'm really,
Yeah.
really looking forward to this. It's
So do I.
it's a unique presentation at the conference, so it's guaranteed to be well attended.
All
Absolutely
right.
guaranteed to be well
Looking
attended.
forward to see you. Thank you for this interview.
Absolutely. And I would just to everybody, I look forward to seeing you along with Giancarlo on the 5th and 6th of April in the Clayton Hotel in Dublin. And all the details are on www.irishhypnotherapyconference.ie. And wherever you're watching this, have an absolutely amazing day.